My name is Dr. Olawale Olabi. I'm a pediatric cardiologist. I take care of children from birth, sometimes in the fetal life, until they're middle-aged, like young adults. So we see patients that have congenital heart disease/defects, patients that are born with heart conditions, and these things developed in the fetal life, and those babies were born with that defect. So we diagnose those conditions anywhere from when the baby is first born into young adult life. So a congenital heart defect is a condition in which part of the heart is formed abnormally. So you should normally have 4 chambers of the heart, but in some situations, you might have 2 chambers of the heart, you might have 3 chambers of the heart, or you might have holes in the heart. Sometimes you can have conditions where you have some valve abnormalities where one of the valves in the heart or multiple valves might be obstructed or leak or something like that. So what we do is we work to diagnose those conditions and find what the defect is. And so it's called a congenital because it's something somebody was born with, and heart because we take care of the heart, and a defect. So congenital heart defect, CHD, also intermittently can be called congenital heart disease because it's something that someone has to live with and that we have to take care of. So in general, looking across the globe, congenital heart disease occurs in 1 out of 100 children, about 0.8 out of 100. So 8 out of every 1,000 kids will see that actually has congenital heart disease. In some places can be a little bit more, some places a little bit less. And in diagnosing those patients, about a quarter of them can actually have some serious congenital heart disease where they actually need some surgical intervention. Not every baby that's born with congenital heart disease needs surgery. Some can be managed medically, and then you wait to see if that person actually needs an intervention. And some might need surgery as early as 1 day of life. So the diagnosis of congenital heart disease is essential to know what the baby has. If that condition is something that needs to be treated in the first few months of life, you want to find out early on in life because that can impact how the kid's life goes. If a condition needs to be treated and surgically repaired in the first year of life and it's missed until later in life, it might not be repairable at that time. So that's why diagnosis is essential. Early diagnosis is key to find what the baby has, what the child has, so you can know when to intervene if necessary. So one of the key things with congenital heart disease is diagnosing early. So when we diagnose early and you have a good team working with you, then the outcome is great. We have some conditions where in the 70s and 60s, those conditions were fatal, but now they have a 99% success rate. So with modern interventions, modern surgeries, modern interventions that we've done now, like cardiac catheterization, we can have a better impact and have a great lifespan for babies that before that wasn't the case. And these babies can now have a pretty much healthy, normal life where they can play sports, they can do different activities, things that if they were left with a congenital heart defect, they wouldn't be able to do. But with the interventions we do now, in surgery, in medications, in cardiac catheterization, the outcome is great. So it's essential that you get screened early, you see your doctor early, you make sure you're seeing a primary care doctor, that person screens you, and you can see a cardiologist. And then you can get diagnosed and treated as necessary. So stay tuned for further tips, insights on taking care of your child's heart and on how to take care of congenital heart disease, how to diagnose it, and how we can help you support your child's journey to a healthy heart.